My name is Nora Finch, and I used to believe that preparation was a superpower. I spent 11 years as the IT director at Westmont Medical Group, a network of 7 hospitals across Oregon. My job was simple in theory: keep the systems running and the data safe. In practice, it meant being the person everyone blamed when technology failed and ignored when it worked. I built our backup system from scratch, layer after layer of redundancy that most people thought was excessive. They called it paranoid. I called it responsible. The thing about digital systems is they're fragile in ways people don't understand. A hospital runs on data now. Patient records, medication schedules, surgical plans, billing systems, everything exists as ones and zeros flowing through servers. When those systems go down, people don't just lose convenience. They lose lives. That's why I built what I called the Triple Shield Protocol. 3 separate backup systems, each independent, each stored differently. One on-site for quick recovery, one off-site for disaster protection, and one air-gapped completely offline for catastrophic scenarios. The air-gapped system was my insurance policy. Every night at midnight, a dedicated server would create encrypted snapshots of our entire network and store them on physical drives that were never connected to the internet. These drives lived in a fireproof safe in the basement, rotated weekly, and tested monthly. It was old-fashioned, expensive, and completely hack-proof because you can't hack what isn't connected. Most of my team understood why this mattered. They'd seen the news stories about hospitals held hostage by ransomware, patient care disrupted, emergency rooms diverted, lives endangered. But understanding costs money, and money requires executive approval. That's where things got complicated. 6 months ago, Westmont hired a new CEO named Derek Pullman. Derek came from the tech industry, specifically from a startup that sold cloud management software. He had an MBA from Stanford, a tendency to use the word synergy in every sentence, and an absolute conviction that anything he didn't personally understand was probably unnecessary. I first met Derek during his introductory tour of our facilities. He walked through the server room with the enthusiasm of someone touring a museum of outdated technology. "This is charming," he said, gesturing at the rows of humming equipment. "Very retro. How old is most of this hardware?" "The core infrastructure was installed 4 years ago," I explained. "We refresh equipment on a 5-year cycle to balance cost and reliability." Derek nodded, but I could tell he wasn't really listening. He was already thinking about whatever efficiency initiative he'd planned before even seeing our setup. "And these backup systems," he said, pointing at the dedicated servers. "How much are we spending annually on redundancy?" I pulled up the budget breakdown on my tablet. Total backup infrastructure costs about $240,000 annually. That includes hardware, software licensing, off-site storage fees, and the air-gapped system maintenance. Derek's eyebrows rose. $250,000 for backups? That seems excessive. "It's comprehensive protection," I corrected. "We're storing health records for 400,000 patients across 7 facilities. HIPAA regulations require robust data protection. Our system ensures we can recover from any disaster scenario within 4 hours." Derek smiled, but it wasn't a warm smile. "Nora, I appreciate your caution, but we're not preparing for nuclear war. We're running hospitals. I've been reviewing our contracts, and our primary cloud provider already includes backup services. We're essentially paying twice for the same protection." This was the argument I'd heard before from people who didn't understand the difference between cloud backups and true redundancy. "The cloud backups are great for routine recovery," I explained patiently. "But they're connected to our network. If ransomware compromises our systems, it can often reach cloud backups too. That's why we maintain the air-gapped offline system. It's physically isolated from any network attack." Derek's smile faded slightly. "So you're telling me we're spending $250,000 annually because you're worried about a scenario that might never happen?" "It's not about might," I said. Ransomware attacks on healthcare systems increased by 73% last year. 3 hospitals in our region were hit in the past 18 months. One of them, Providence Memorial, was offline for 11 days because their backups were encrypted along with their primary systems. They had to rebuild from scratch. Derek waved his hand dismissively. Providence had outdated security. We have firewalls, antivirus, monitoring systems. We're investing in prevention, which is smarter than preparing for failure. I wanted to explain that prevention and preparation weren't opposing strategies, but I recognized the look in his eyes. He'd already made up his mind. People like Derek didn't like being told they might be wrong, especially by someone they viewed as overly cautious. Over the next few weeks, Derek launched what he called a comprehensive efficiency review. Every department had to justify their budgets, demonstrate value, and identify potential savings. The subtext was clear: cut costs or I'll cut them for you. My team was called into a conference room on a Tuesday morning in March. Derek stood at the head of the table with his laptop displaying a presentation titled IT Modernization Initiative. Sitting beside him was Kyle Torres, a consultant Derek had brought in from his old company. Kyle looked about 25 and had the overconfident air of someone who'd learned everything from YouTube tutorials and thought that made him an expert. Let's talk about redundancy, Derek began, clicking to a slide showing our backup costs highlighted in red. Nora's team is currently spending $240,000 annually maintaining what amounts to insurance against an unlikely event. Meanwhile, our cloud provider charges us $60,000 for backup services that we're not fully utilizing. Kyle jumped in, eager to prove his value. I've analyzed your infrastructure, and frankly, the air-gapped backup system is overkill. It's a solution from the 1990s. Modern cloud architecture with proper security makes offline backups unnecessary. I felt my jaw tighten but kept my voice professional. Kyle, with respect, cloud backups are part of our connected infrastructure. Sophisticated ransomware can identify and encrypt cloud-connected backups before triggering the main attack. The air-gapped system is immune to that because it's physically disconnected. Kyle smiled condescendingly. That's theoretical. In practice, if your security is good enough, you prevent the attack entirely. You're building a bunker when you should be building a better fence. We have both, I said. The fence is our firewall and monitoring systems. The bunker is our disaster recovery plan. They serve different purposes. Derek cut in. Nora, I understand you've invested significant effort in building this system. But we need to be realistic about cost versus benefit. How many times have you actually needed to use the air-gapped backups? Never, I admitted. Because our other systems have worked. Exactly, Derek said, as if I'd just proven his point. You've spent over $2 million in the past decade on a system you've never used. We've never needed it because we've been lucky, I countered. But luck isn't a strategy. The healthcare sector is the #1 target for ransomware because attackers know hospitals can't afford downtime. Patient safety depends on data access. We're not just protecting files. We're protecting lives. Derek closed his laptop, signaling the discussion was over. I appreciate your passion, Nora, but the decision is made. We're eliminating the air-gapped backup system effective next month. The hardware will be repurposed, the off-site storage contract will be cancelled, and we'll consolidate everything to our cloud infrastructure. Kyle will work with your team on the migration. I felt like I'd been punched. Derek, this is a mistake. I'm formally requesting that we at least maintain a scaled-down version of the offline backups until we can prove the cloud-only approach is secure. Your objection is noted, Derek said, standing up. But we're moving forward. Change is uncomfortable, Nora. Try to embrace it. The meeting ended. My team filed out silently, looking at me with expressions that mixed sympathy and concern. I spent the rest of the day drafting a formal risk assessment. I documented every ransomware case I could find where cloud backups had been compromised. I cited industry best practices, HIPAA guidelines, and recommendations from the FBI's cyber division. I built a case that was ironclad and evidence-based. I submitted it to Derek, the board of directors, and our compliance officer. 2 days later, I received a response from Derek. It was 3 sentences long: "Thank you for your thorough analysis. However, the decision stands as discussed. Please focus your energy on supporting the transition rather than resisting it." That was the moment I realized Derek didn't care about being right. He cared about being in charge. Proving him wrong would only make him dig in harder. I had 2 choices: quit in protest or stay and prepare for the inevitable disaster. I chose to stay, but I also chose to prepare. Over the next 3 weeks, Kyle supervised the dismantling of my backup system. The dedicated servers were wiped and repurposed. The off-site storage contract was terminated. The fireproof safe in the basement was emptied, and the backup drives were formatted for reuse elsewhere in the organization. I watched it happen with the sick feeling of someone watching a safety net being cut while people were still on the tightrope. But I wasn't completely helpless. There was one thing Derek and Kyle didn't know about: my personal insurance policy. Years ago, when I first built the air gap system, I'd created a secondary backup protocol for absolute worst-case scenarios. Once a week, I personally created an encrypted snapshot of our most critical systems and stored it on a ruggedized external drive that I kept at home. It wasn't official policy. It wasn't in any documentation. It was just something I did because I couldn't sleep at night knowing we had no fallback position. The drive lived in my home office, disconnected from everything, updated every Sunday night after I'd finished my weekly system health checks. It contained patient databases, medication records, surgical schedules, billing systems, basically everything needed to keep the hospitals running if the main systems failed. Was it technically against policy to take hospital data off-site? Probably. Was it encrypted with military-grade security that would take decades to crack? Absolutely. Would I rather face a policy violation than watch people die because we couldn't access medical records? Every single time. I didn't tell anyone about this backup. Not my team, not my husband, nobody. If Derek found out, he'd fire me for insubordination and delete the drive out of spite. So I kept quiet, maintained my personal backup, and hoped I'd never need it. The new cloud-only system went live on April 15th. Kyle spent the morning walking around the IT department like he'd just launched a rocket to Mars, talking about how streamlined everything was now. "See how much faster the recovery point objectives are," he said, showing me dashboards on his laptop. Cloud-native architecture eliminates the latency of physical systems. We can restore from any point in the past 72 hours in under 30 minutes. What happens if the cloud environment itself is compromised? I asked. Kyle rolled his eyes. "That's not how it works, Nora. The cloud provider has redundant data centers, advanced security, and guaranteed uptime. You're still thinking in terms of local hardware vulnerabilities." "I'm thinking in terms of attack vectors that target cloud infrastructure," I replied. Ransomware groups know that companies have moved to cloud backups. They've adapted their tactics to compromise cloud environments before deploying the encryption payload. Kyle closed his laptop with more force than necessary. "You really can't let this go, can you?" Derek made a decision. "You lost the argument. Maybe it's time to accept that your way isn't the only way." He walked away before I could respond. My team avoided eye contact. They could sense the tension but didn't want to get caught in the crossfire between old-school IT philosophy and new-age efficiency thinking. For the next 2 months, everything seemed fine. The cloud backups worked smoothly. System performance was good. Derek praised Kyle at every executive meeting, holding up the IT department as an example of successful modernization. I started to wonder if maybe I had been too paranoid. Maybe the threat I'd spent years preparing for really was more theoretical than practical. Maybe Derek's confidence wasn't arrogance but justified optimism based on actual improvements. Then June arrived, and with it came the email that changed everything. It happened on a Tuesday afternoon. I was reviewing security logs when my inbox notification chimed. The sender was listed as IT support. The subject line read, "Urgent, server maintenance required." I almost deleted it immediately because I knew every member of our IT team personally, and nobody would send an email with such a generic signature. But something made me open it. The email body was brief: critical vulnerability detected in main database server. Please click the link below to verify your credentials and authorize emergency patching. It was a textbook phishing attempt, the kind I'd trained our entire staff to recognize and report. Terrible grammar, generic signature, suspicious link that clearly led somewhere malicious. I immediately checked the email headers and confirmed it came from an external source disguised to look internal. I forwarded it to our security monitoring service and sent out a company-wide alert warning everyone to delete similar emails without clicking anything. Within an hour, I'd identified 6 other employees who'd received identical phishing emails. None of them had clicked the links, thanks to our regular security training. I felt a small surge of satisfaction. Our defenses had worked exactly as designed. That night, I went home feeling like we'd dodged a bullet. My husband asked how work was, and I told him about catching the phishing attack. "Sounds like you're still earning your paranoia badge," he joked. I laughed, but something nagged at me. Phishing emails usually came in massive waves targeting thousands of organizations simultaneously. This attack felt different. It was targeted specifically at Westmont Medical Group employees. Someone had researched our organization enough to craft emails that referenced our actual systems. That level of customization suggested this wasn't random. It was reconnaissance. I couldn't shake the feeling, so I logged into our security monitoring system from home. I spent 2 hours reviewing logs, looking for anything unusual. Traffic patterns were normal. No unauthorized access attempts. No suspicious file movements. Everything looked clean. I finally closed my laptop around midnight and went to bed, telling myself I was overreacting. At 3:14 in the morning, my phone started ringing. The caller ID showed Kyle Torres. My heart immediately started pounding because Kyle calling me in the middle of the night meant something catastrophic had happened. I answered, already getting out of bed. "What's wrong?" I asked. Kyle's voice was shaking. "Nora, we have a situation. You need to get to the hospital immediately. All of them. Every facility in the network is down." I was pulling on clothes as he spoke. Define down. What exactly isn't working? Everything, Kyle said, and I could hear the panic barely controlled beneath his words. Every server, every workstation, every database. They're all displaying the same message. Red screen, skull icon, text saying our files have been encrypted and we need to pay Bitcoin to get them back. Ransomware. The nightmare scenario I'd spent years preparing for had finally arrived. "What about the backups?" I asked, though I already knew what he'd say. "That's the problem," Kyle admitted. "The cloud backups are gone. Encrypted. Every single restore point from the past 72 hours is corrupted. Nora, we have nothing. No patient records, no medication databases, no surgical schedules. 7 hospitals are completely blind." I was already in my car, backing out of the driveway. "I'll be there in 20 minutes. In the meantime, isolate every system that isn't already encrypted. Disconnect from the internet. Shut down anything still running. We need to contain this before it spreads further." The drive to our main hospital campus normally took 30 minutes. I made it in 18, running 2 red lights and exceeding the speed limit by margins that would have gotten me arrested if any police had seen me. The parking lot was chaos. Ambulances were being diverted to other hospitals. Staff members stood outside smoking and looking worried. Security guards were directing people away from the main entrance. I parked illegally and ran inside. The emergency room was operating on paper. Nurses were writing notes by hand, doctors were making medication decisions from memory, and the registration desk was taking patient information using clipboards that probably hadn't been touched in a decade. I found Kyle in the server room, looking like he'd aged 10 years in 3 hours. Around him, my entire IT team was frantically trying to salvage something, anything, from the encrypted systems. "Show me," I said. Kyle pulled up the ransom message on his laptop. It was professionally designed, which somehow made it more terrifying. White text on red background. A countdown timer showing we had 96 hours to pay. The message was clear: your network has been secured by Black Vault Security Services. All files, databases, and backups have been encrypted with military-grade algorithms. Attempting to decrypt without our key will result in permanent data loss. Payment required, 150 Bitcoin, approximately $3.2 million US. Payment must be received within 96 hours. After deadline, decryption key will be destroyed. Contact us through the provided Tor link for payment instructions. I felt sick. $3.2 million, and even if we paid, there was no guarantee they'd actually provide the decryption key. Ransomware attackers were criminals, not customer service representatives. How did they get in? I asked. Kyle looked down. We're still investigating, but it looks like they compromised admin credentials sometime yesterday. They spent hours mapping our network, identifying backup systems, and planting the ransomware everywhere simultaneously. Then they triggered it at 3 a.m. when minimal staff would be online to respond. The phishing email, I said. Someone clicked it. Kyle nodded miserably. We think so. We found evidence that one employee opened the email on their phone after hours. Where's Derek? I asked. Conference room, Kyle said. With hospital administrators, legal counsel, and the FBI. They're trying to decide whether to pay the ransom. I started walking toward the conference room. Kyle called after me. Nora, Derek specifically said you shouldn't be involved in the decision-making process. He said your judgment might be compromised because you opposed the cloud migration. I stopped and turned around. My judgment is the only thing that isn't compromised right now. I'll deal with Derek. The conference room was packed. Derek sat at the head of the table, looking exhausted but still trying to project authority. Hospital administrators were arguing about patient safety. Our legal counsel was explaining liability concerns. 2 FBI agents were taking notes. I walked in without knocking. Derek looked up, irritation flashing across his face. Nora, this is a restricted meeting. We have backups, I said. The room went silent. Derek stared at me. What are you talking about? Kyle said all backups were encrypted. All the official backups were encrypted, I confirmed. But I maintained a personal backup system. Air-gapped, offline, encrypted, completely isolated from the network. It's stored at my house. I updated it last Sunday night, which means it's 5 days old, but it contains everything we need to restore operations. Derek's face went through several expressions: confusion, realization, and then anger. You maintained unauthorized backups of patient data at your home? That's a massive HIPAA violation. That's grounds for immediate termination and possibly criminal charges. It's also the only reason we're not paying $3 million to criminals right now, I replied. One of the FBI agents spoke up. Ma'am, can you verify that these backups are legitimate and uncorrupted? I can, I said. I can also have restoration started within 2 hours if someone authorizes me to proceed. The hospital administrators looked at Derek. He was trapped, and everyone in the room knew it. If he authorized using my backups, he'd be admitting that eliminating the air-gapped system had been a mistake. But if he refused, people would die. One of the administrators, a woman named Dr. Helen Ortega who ran our largest hospital, stood up. "Derek, with all respect, I don't care about your ego or Nora's employment status right now. I have 200 patients in my facility who need medications, treatments, and care plans that we cannot access. If Nora can restore those systems, authorize her immediately, or I will personally call every board member and explain why you're prioritizing policy over patient safety." Derek's jaw clenched. He looked at me with pure hatred, but he nodded. "Fine. Restore the systems. But this conversation about your unauthorized data handling is not over." "I look forward to it," I said. I left the conference room and called my husband. "I need you to do something weird and urgent. Go to my office, open the bottom drawer of my desk, and you'll find a ruggedized orange hard drive. Bring it to Westmont General immediately." He didn't ask questions. On my way. 30 minutes later, he arrived with the drive. I connected it to an isolated workstation, entered my decryption password, and watched 5 years of careful preparation validate itself. The restoration took 14 hours. My team worked in shifts, methodically rebuilding our network infrastructure from the ground up while keeping everything isolated from the internet until we were certain the ransomware was completely purged. We restored patient databases first, then medication systems, then surgical schedules. By noon, doctors could access medical records again. By evening, the electronic prescribing system was operational. By midnight, all 7 hospitals were functioning normally, running on systems restored from my unauthorized, paranoid, supposedly unnecessary backup. The FBI agents stayed throughout the process, documenting everything for their investigation. They told me that the ransomware group had been targeting healthcare organizations for months, and our attack matched their pattern perfectly. They also told me that fewer than 30% of ransomware victims ever fully recovered their data, even after paying. My backup had saved not just $3 million but potentially hundreds of lives that could have been lost during extended system downtime. Derek avoided the server room while we worked. I didn't see him until the next morning when I was called to his office. He sat behind his desk, looking like he hadn't slept. Kyle stood in the corner, wisely staying silent. "Nora," Derek began, his voice carefully controlled. "You violated multiple policies by maintaining off-site backups without authorization. You created a significant security risk by taking patient data home. You went against direct orders when I eliminated the air-gapped backup system." I waited, saying nothing. Derek continued. "However, you also saved this organization from catastrophic failure. The board has been informed of both the policy violations and the results. They've asked me to convey their gratitude while also making clear that proper protocols must be followed going forward." "What does that mean?" I asked. Derek sighed. "It means you're being promoted to Chief Information Security Officer, reporting directly to the board instead of through me. It means you have full authority to implement whatever backup and security systems you deem necessary, regardless of cost. And it means I've been instructed to approve whatever you recommend without question." I almost laughed. Almost. Instead, I nodded professionally. "What about Kyle?" Derek glanced at Kyle, who looked like he wanted to disappear into the wall. "Kyle's consulting contract has been terminated. His recommendations, while well-intentioned, did not adequately account for the threat landscape specific to healthcare organizations." Translation: Kyle was fired, and Derek was blaming him to save his own job. It was cowardly but predictable. "I want my air-gapped backup system restored," I said. "Not just restored, but expanded. I want triple redundancy, regular testing, and sufficient budget to maintain it properly." Derek nodded. "Approved. What else?" "I want Kyle's dismissal handled professionally with appropriate severance," I said, surprising both of them. "He made mistakes, but he was following your direction." He doesn't deserve to be the only scapegoat. Derek looked uncomfortable but nodded again. Fine. Anything else? Yes, I said. I want you to send a company-wide email explaining what happened, acknowledging that eliminating the backup system was a mistake, and committing to prioritizing security over efficiency going forward. People need to understand that caution isn't paranoia. It's responsibility. Derek's face tightened, but he couldn't refuse. Not with the board watching. 2 weeks later, the FBI arrested the ransomware group responsible for our attack. It turned out they were operating from Eastern Europe, targeting healthcare organizations specifically because they knew hospitals couldn't afford prolonged downtime. Our case helped identify their methods and led to charges against 6 individuals. The phishing email that started everything had been clicked by a night shift nurse who'd been checking her work email on her phone while exhausted after a 12-hour shift. She was devastated when she realized what happened, but I made sure everyone knew it wasn't her fault. Social engineering attacks work because they exploit human nature, not because people are stupid. My new role came with a significant raise and complete authority over security infrastructure. I rebuilt the air-gapped backup system exactly as I'd designed it originally, but better. More redundancy, more testing, more protection. Derek barely spoke to me after that. He resigned 6 months later to take a position at another company, where I'm sure he's currently explaining to someone else why their security concerns are probably excessive. I still maintain my personal backup at home, though now it's officially sanctioned and documented. Some people call it paranoia. I call it being prepared for when, not if, disaster strikes. Because at 3 a.m. on that June morning, paranoia saved 7 hospitals, 400,000 patient records, and countless lives. And I'd do it all over again.